Hi, Sarah.
Hello.
How are you?
Fine, you?
I'm good. So I see here in your chart that you got an appointment because you had an allergic reaction.
Yeah.
Is that right? Okay. So you had a rash on your back.
Yeah.
Did you get any other symptoms besides that?
No, nothing.
Okay. No vomiting or swelling, nothing like that?
No, nothing.
Okay, no other symptoms. Very good. And I see here that you don't know exactly if you ate something that triggered it.
No.
Nothing specific.
Not sure.
Okay. Okay, so just gonna ask you a couple of questions. How's your diet? Do you eat everything, or do you have like a specific diet, like
No,
vegan?
everything.
Everything. Okay. Do you exercise?
Yeah. Box.
Boxing, okay. How many times per week would you say?
2 or 3.
2 or 3,
per
very
week,
good. Okay. How do you usually stay hydrated? Do you drink enough water during the day?
Yeah.
Okay. Do you take any medicine regularly?
No.
No. Very good. Okay, so no known allergies, no medication. Very good. So I'm going to get started with your vital signs. Can you go ahead and confirm your first name
Lily.
and your date of birth?
3
Mm-hmm.
September.
It's 90.
Yeah.
Okay, perfect. Okay. Just gonna put on my gloves. Okay, I'm gonna go ahead and slide this on your arm. Okay, I'm gonna place that there. This here. Just gonna put on my stethoscope. Okay, go ahead and uncross your legs. Very good. Okay, very good. Just gonna slide this out. Okay, I'm going to take your temperature. Put this right here. This thermometer is going to go under your tongue. And close your mouth. Get close. Okay. 98.4, that's normal. 97 oxygen and 88 heart rate. That's very good. That was 98.4. 7 oxygen and room air. And 88 heart rate. Blood pressure was 105/72. So that is normal. Okay, very good. Gonna listen to your heart. Just gonna go ahead and place this right here. Okay, I can hear only S1 and S2. No S3, no S4, and no signs of murmur, so that's great. You can go ahead and take a deep breath. Exhale. Okay, again, go ahead and take a deep breath. Exhale. Okay, go ahead and place this right here. Go ahead and take a deep breath. Exhale. Okay. One more time, inhale. Exhale. Okay. Your lungs sound clear. No sounds of wheezing, no extra sounds there, so heart and lungs are normal. Sometimes with allergic reactions, you could have swelling in your lungs that could make breathing a little bit harder. So it's great to know that that's not the case. Okay, I'm going to take a look at your scalp. Just want to check if there's any signs of a rash. Sorry about that. Just want to check. Here I see a little bit of signs of a rash right here on your scalp. Okay, so yeah, there's a little bit of irritation on your scalp. And I definitely see some breakouts here. Does it itch at all? Does that hurt? No. So definitely a little bit of rash that we found is mostly closer to your hairline. Really notice anything. The back of the head. Okay, I'm gonna check the other side. Okay. So again, some breakouts close to the hairline on this side as well. Close to the ears. And turn this way, please. Let's see. Okay, there's one more here on the back. You look down. Okay, yeah. So some irritation and breakouts on your scalp. This side. Painting your head. Just want to make sure there's no lumps or masses besides those little breakouts we found. I do not notice any swelling, no lumps or masses that are out of the ordinary here. Feels very normal. Okay. Me palpating your lymph nodes. Submental lymph nodes seem normal, not swollen. Okay, submental lymph nodes seem normal. Submandibular seem to be normal as well, no swelling here. Okay, checking post-auricular lymph nodes and pre-auricular lymph nodes. No swelling there either. Moving down your neck. Moving down the neck. Checking your trachea to be midline. That's very good. Checking lymph nodes along your clavicle. Would you be able to do this for me? Okay. Is there any pain?
No.
Okay, very good. Okay, I'm going to be checking your pupils. You can just look here at my fingers. Just make sure that they're constricting and dilating normally. Okay. Okay. Pupils are normal. They're consensual, round, and reactive to light. Okay, I'm just going to check your conjunctiva. Okay. Everything seems normal, light pink in color. Okay. Do a quick vision test. Can you hold this on your hand? Just go ahead and hold it at arm's length like that. Can you read this row right here?
Yeah, L, T, F, P, H.
Okay, do you know what color is this?
It's green.
And this one?
It's red.
Okay. Do you know what letter is that one?
Yeah, it's B,
This one?
L,
This one?
H,
This
E,
one? This one?
D,
This
T.
one right here. Okay, very good. So that seems to be normal. Let's take a look at your eyes. Just go ahead and look straight. So, optic nerve looks intact. No scratches in the retina. No concerns there. It's clear as white. No irritation or swelling. It's perfect. Okay. Optic nerve again looks intact. Do not notice any swelling. Everything's normal. To be able to look up, just taking a look at the mucus. Your mouth looks normal. There's no irritation, no swelling. Nose looks normal as well. I'm going to use this tongue depressor to take a look at your throat. Okay. Tonsils are normal size. It's very normal. Just going to take a look at your ear. Penny membrane looks pearl gray. Nothing concerning. Ear canal is any wax buildup. Okay. Tympanic membrane again is pearl gray. I don't see any irritation or swelling. Canal is clear. Okay, Lily, I'm gonna ask you to lay on the bed. Take a look at your legs. Make sure there's no rashes in there either. And take a look at your stomach. Okay, definitely there's no swelling that I can tell here. No signs of edema. Okay. Feet look healthy. Okay. I do not notice any rash or irritation in here. Notice any rash or irritation on your feet. No inflammation. That's very good. Pedal pulses. Symmetrical. Normal. Okay, very good. Okay, I'm gonna lift up the gown a little bit just to check your abdomen. I'm gonna be listening to your bowel sounds. Okay, I do not notice any sounds out of the ordinary. There's no inflammation, no tender areas. tapping lightly. I'm just listening to your organs, making sure that everything sounds normal. Okay, you can go ahead and sit back on the bed for me. Okay, Lily, I'm gonna put up your hair. I'll put this up to help have better access to your back. I'm going to be checking the skin on your back before we get started. Gonna unbutton the gown. Okay, I'm just taking a look at the rash here on your back. It does seem that it could be an allergic reaction. So far, we've found rash on your back and on your scalp, but not anywhere else in the body. So I can see some localized areas where the rash seems to be more prominent, which is the upper back, close to the shoulders, but not right on the shoulders. Kind of along the scapula. Down here on the sides. Other than those areas where the rash is pretty noticeable, I don't notice any inflammation. The area along the spine, the middle of the back is pretty clear. So that's great. Very good. So I'm gonna get started with the allergy test. Maybe first prepping the site. Okay, I'm gonna be cleaning the area. I'm gonna stay clear of the rash that you already developed on your back. So we're gonna use this area where there's not a lot of breakouts. Just cleaning here. Make sure we wipe that off. Okay. Yes. Now I'm going to be marking the sites we're going to be doing 6, allergens. Plus the control sides that we have are positive and are negative. Okay, I'm gonna get started with my control sides here. Positive. The negative here. Okay, so we have allergen 1. Allergen 2 right here. Allergen 3. Allergen 4. Number 5. And number 6. Okay, I'm gonna let that sit for 15 minutes, and then we'll take a look at the results, okay?
Okay.
Okay, Sarah, so I'm gonna be measuring the allergic reactions that were caused by all the allergens on your back. And start just checking our control side right here. Okay, this is 11 millimeters. This is 17 millimeters by 30. And the negative control side is pretty small. It's just a tiny 2 millimeters by 2.5 millimeters. So definitely we know that is a negative. Number 1, this one is 2.5 by 2. Number 2 is a lot bigger. It's 14 by 15 millimeters. Number 3 again, very small. 2 by 1.5, so almost not even noticeable. Number 4 is definitely not noticeable at all. Number 5, it's a lot bigger, 18 by 17. And number 6 is in between with 6 millimeters by 5. So I'm just going to make note of that. So definitely we have number 2 and number 5 are reactive to allergens, and number 6, it was 5 by 6 millimeters, so that one is inconclusive. Okay, 1, go ahead and wipe off the numbers on your back. Just making sure that we get rid of these markings. Okay, and I'm going to apply a little bit of hydrocortisone ointment. And this is going to help reduce some of that inflammation and any itchiness that might be caused by the allergic reactions to the allergens that we just tested. I'm just rubbing this ointment in, making sure that it penetrates the skin. Just massaging it. The skin, I can see it's already working. Those allergic reactions on your back are mostly gone. Okay, Sarah, you can go ahead and sit this way. I'm just going to button up your gown. Just want to discuss with you the results and my findings. Lily, so according to my findings, you are not allergic to shrimp, walnuts, ginger, almonds. It's a little bit inconclusive, so I'm going to have to ask you to get some blood drawn, send it to a lab, and we're going to need additional testing on that. And you are allergic to fish and soy.
Okay.
So that is definitive. You are allergic to that. So I'm going to give you a list of just recommendations, things that you should avoid.
Okay.
And I'm going to give you a prescription for an EpiPen as well.
Yeah.
So you can have that just in case you need it. Okay?
Okay, perfect.
I will call you back as soon as I have the test results, and I'll discuss with you further on whether you're allergic to almonds or not. Okay?
Okay, perfect.
Okay.
Yeah.
Well, it was very nice seeing you, and if you have any concerns in the meantime, you can definitely give me a call.
Perfect.
Okay?
Thank you.
Thank you. Bye-bye.
Bye.